So, hello everyone. You're very welcome to this evening's webinar. So this evening, our webinar is on accessing mental health services, and we have two speakers for you this evening. We have Tara O'Donnell Killen of Thriving Autistics, and we also have Rachel O'Connor of St. Michael's House and the Adult Autism Practice. And they're here with us tonight to discuss just pathways for meaningfully accessing mental health services as an autistic adult through both public and private systems. I know that's a mouthful. Bear with us. So, just to let you guys know that tonight's webinar will be recorded. So, if you have to drop out or you want to rewatch it, there will be a recording available on our YouTube page. So just very quickly introduce our two amazing speakers. So Tara O'Donnell Killen. So she's the founder and CEO of Thriving Autistic, which is a nonprofit specializing in supporting the well-being of autistic adults. She's a psychologist, researcher, lecturer, and co-author of the Adult Autism Assessment Handbook, a neurodiversity affirmative approach. Tara is also an autistic parent of three autistic children. And then we have Rachel O'Connor. So Rachel is a clinical psychologist working in St. Michael's House with Children's Disability Services. She also works with the Adult Autism Practice, providing neuroaffirmative autism assessment to adults across Ireland and the UK. So Rachel's doctorate research is focused on autistic adults' mental health, specifically investigating autistic people's perspectives on the factors that have impacted their mental health. She hopes that the findings will increase our understanding on how to prevent mental health difficulties for autistic people. So that was quite a mouthful. So I'm going to pass you over to your speakers now. I'm not sure which one's going first, but whoever
Yeah,
is going
I'm
first,
going first.
off you go.
Thanks a million, Nicola.
No worries.
Right, I'm gonna just share my screen now. Here we go. Right, that looking good. Thank you for that thumbs up. Okay, so as everybody knows, today we're going to talk a little bit about meaningfully accessing mental health services as an autistic adult in Ireland. So, I suppose I'm going to speak a little bit about the situation in the public health service and how you might go about accessing services there. And then Tara is going to speak a little bit about accessing private services, specifically, or in particular, I suppose her practice in Thriving Autistic. And then I suppose myself and Tara are going to chat a little bit together about some, I suppose, commonly asked questions when it comes to accessing mental health services, difference between kind of the public and private sector, and I suppose things that we find come up quite a lot. And then, as you know, there'll be kind of a Q&A for maybe anything that we didn't touch on together. So first of all, I'm going to talk a bit about the public health service. And I suppose what I'm going to talk about is based a little bit on my experience working in the public health service and a little bit on the research that I did as part of my doctorate. So the research that I did was interviewing autistic adults about their experiences accessing services, and that includes private, public, charities, everything, but services specifically aimed at supporting mental health. So when I did that research, there was, several kind of stepping stones, I suppose, around actually accessing that meaningful support that you might like to access. So these are kind of these stepping stones, and that's how I'm going to kind of structure my piece of the webinar today, how to maybe get past each of these steps in accessing that meaningful support. So first of all, very practically thinking about, getting a referral somewhere, for that referral to be accepted, and to make sure that that is a suitable service to meet your needs. And then once I suppose that's overcome and you're in the right service for you, will you be offered a suitable intervention, and how can you figure out what is a suitable intervention for me? What do I need to support my mental health right now? The next piece would be around working with a suitable professional. So you might have figured out the type of support that might be helpful for you, but are you working with someone who also meets your needs? And then finally, a piece around, I suppose, adjusting more, I suppose, standard interventions to suit your style and your needs. And I suppose that bit in particular, I'll just touch on briefly because Tara is going to speak quite a bit more about that. Okay, so I suppose this is typically how the mental health services in the public sector are kind of structured. So the first thing to think about is, would you be accessing a disability specific service, or would you be accessing a service that is not disability specific? So it might be considered more of a mainstream mental health service. So if you are an autistic adult with no intellectual disability, or perhaps with an intellectual disability which is considered in the mild range, and I suppose you might have a report that specifies something around that, then these kind of these three options here will be what you're looking at. So I suppose it's kind of a tiered service, or a tiered system, I should say, where maybe the lowest level of need in terms of mental health might be met by what's called counselling and primary care. So I'll tell you a little bit more about that service in a few minutes, but it's really kind of a short-term service for more kind of mild, maybe mental health difficulties, or maybe if you're struggling with a particular situation for a short period of time, but it's maybe not a long-term mental health difficulty. And then the next step up from that would be primary care psychology, or maybe primary care mental health. Depending on the area that you live in, one of these might be available, but it's really kind of area dependent. And then kind of the next step up from that would be what's called community adult mental health. And this is kind of specifically for people who might have what we consider kind of moderate to severe mental health difficulties. So it might be if you're really struggling very significantly day to day, and maybe it's been going on for quite a while, then that would be the community adult mental health service. And then I suppose the other types of services that are available are for people with an intellectual disability, which is kind of specified as the moderate, severe, or profound range. Okay, so this is, I suppose, the language that is used within the services, and some of the language is not very, neuroaffirmative or very nice. But I suppose this is what you would need to be kind of demonstrating for yourself, or maybe, if you're supporting somebody else with an intellectual disability, these will be kind of the services for them. So there'd be adult disability services, and this level would kind of be for people who might have maybe more mild mental health difficulties, or just some kind of emotional challenges for a period of time. And then for people with kind of, again, that more what we call moderate to severe mental health difficulties, that will be kind of mental health of intellectual disability services. So that's kind of an overview of what's out there, but that will kind of vary quite a bit from area to area. But this is, technically speaking, what should be in place. So just to go into a little bit more detail around those services, and I can make these slides available after the webinar if it's helpful to have these bullet points to get your head around them. But for autistic adults with no intellectual disability, or what we term a mild intellectual disability, like I said, there's the counselling and primary care. This is, an important point, that this is for people with medical cards only. And it's kind of only really suitable for people with maybe mental health or emotional difficulties more in the milder end, and it is kind of time limited counselling. So that's counselling and primary care. Then, like I said, the next level up would be primary care psychology or primary care mental health, and that would be more so maybe mild to moderate mental health difficulties. They offer kind of a slightly wider range of things, so it could be a group, or it could be one-on-one therapy. And yeah, like I said, it's potentially not available in all areas of the country, but it depends on where you're living. And then finally, community adult mental health, like I mentioned, is more for, I suppose, more significant mental health difficulties that maybe have been going on quite a while. And these teams would have a multidisciplinary team, meaning they'd have maybe a psychiatrist, psychologist, occupational therapist, speech and language therapist, a big team of professionals there. And they can kind of link in with inpatient services as well. For all of these, it should be possible to get a referral through your GP. Some of these services also accept self-referrals, so that means you can get the referral form yourself. Sometimes they're available online, and you can fill it in yourself. And then I suppose this is the kind of equivalent for autistic adults with intellectual disability in that more moderate, severe, or profound range. And so with, I suppose, more the mild end of mental health difficulties, it would be that just the kind of standard adult disability services that might support that, maybe one of the psychologists on that team, or if someone has a mental health difficulty that is more severe in that moderate or severe range, it would go to the specialist service, which is the MHID team. Okay, so that's lots of information that's not particularly exciting or interesting, but hopefully it's practical, and gives you a bit of guidance around where you might be able to go within the public service. So then I suppose once you've maybe identified what service is right for you, where is going to accept you, accept your referral, and offer you support, then the next piece is what therapy or intervention would be best for you. So there's lots of different things that you might be offered. You might be offered medication, you might be offered a group intervention, you might be offered individual therapy, or you might be kind of linked in with services in your community, that again, that varies hugely from area to area, but there's some things that you might be offered. Everybody is different in terms of what they find helpful, and I suppose a lot of people, at least in my research, it said that people tended to try a few things before they found the best fit for them, the right approach maybe. So when you're thinking about what is going to suit you, these are some things that you could consider. So what are maybe some of the reasons for your mental health difficulties? Is there maybe something really big that's happened in your life recently, or is it something that's been kind of present your whole life, and it's been something you've been dealing with for a while, or maybe do kind of if there's any reason. And I suppose if you are working with a service and professionals in that service, ideally what you would hope they'd be doing is finding out a bit about you and trying to help you identify if there are some underlying reasons for the mental health difficulties that you're experiencing, and then that should maybe guide what intervention is going to suit you best. Other things to consider: how long have your mental health difficulties been going on for? How much do they impact your life day to day? And if they've been going on a very long time and there's a huge impact, the chances are you might be looking at trying to access a service that's more in that moderate to severe range of mental health difficulties, and you might be maybe looking for more intensive intervention. So for people, say, who might have only experienced maybe a short-term mental health difficulty, something like a group might be more suitable. For people who are struggling a bit more, individual therapy might suit them better. But that's also down to individual preferences. So thinking about how comfortable do you feel in groups? Do you like sharing and chatting with others? And then another thing to think about is, do you like things to be structured, or do you prefer more kind of an unstructured, explorative approach to things? And those kind of things might guide your decision around, or sometimes it's not your decision, but I suppose it might guide what you'd like to be offered, or what you might request from a service. So I'm just going to talk through just a few of the common psychological therapies that you might be offered. Some of these things are offered individually in a one-on-one setting with a therapist. Sometimes these things might be offered in a group setting, but just to help you maybe understand the differences a little bit. So I think that the one we hear about all of the time is cognitive behavioral therapy, or CBT. So with CBT, it's generally quite a highly structured therapy. There's kind of particular steps that your therapist would bring you through, and it's often time bound. So that means that you might be offered a specific number of sessions. It might be 6 or 8 or 12, and it's often short term. So CBT is not usually something that is open-ended. It usually has a fixed number of sessions. And what CBT looks to do is kind of explore how your thoughts and emotions and behaviors are all linked, and I suppose how your particular thoughts, emotions, and behavior are linked to maybe your past experiences or your beliefs about the world, your beliefs about other people, or your beliefs about yourself. And for some people, it suits them really well. A lot of the time, there's a real practical element to it. So there can be, you know, I suppose this concept of maybe facing your fears and exposure therapy, those are kind of things that are linked with CBT as well. And so for some people that suits them very well. For others, it's not suitable. And like any therapy, if you're autistic and you're working with a therapist, adjustments do need to be made to suit an autistic neurology and autistic communication and style of coping. So those things need to be considered as well. But yeah, that's in a nutshell CBT. Another one that we might hear quite a bit is dialectical behavior therapy. This is DBT. So the reason that this one often kind of comes up and might be offered to autistic people is because sometimes, or quite a bit in mental health services, autistic people might be presenting with difficulties managing big emotions and maybe engaging in self-harm or suicidal behavior or anything like that. And I suppose DBT is a therapy that is designed to support people who have difficulty with those big emotions and might end up self-harming and things like that. So DBT, again, some people find it really helpful, some people find it really unhelpful. It's really down to the person. But just to give you a sense, it's also usually highly structured. It can be time bound. Usually it's slightly longer term than CBT. A lot of the time DBT will involve group work as well as individual sessions, one-to-one. And there's a big focus in DBT on skills. So particular skills that people will be kind of learning and trying out to manage kind of maybe crisis situations or when big emotions come up, whatever they might be. So that's kind of what DBT is. Again, some people find it brilliant. Some people, it's not their style. And then I suppose the third one I just want to mention today is psychodynamic therapy. So this is a type of therapy that's usually a lot less structured. Usually it's not time bound, although sometimes in the public sector everything is time bound. But traditionally it wouldn't really be time bound. The focus of psychodynamic therapy is really to explore connections between early life experiences or early life relationships and someone's current difficulties in life. So it's quite different to CBT and DBT, and it might suit people who prefer that less structured approach and want to maybe just have the time and space to discuss and explore things about themselves and about their experiences. Quick check of my time. Okay, I'm going to keep flying. So then I suppose the next barrier to overcome is, finding a professional or a therapist that suits you. And these kind of bullet points here are just, again, based on the research that I did of what autistic people said, made for a good therapist or made for maybe a negative experience with the therapist. And so I suppose one maybe big takeaway is a lot of autistic people said to me, at least as part of my research, that what they found most important is that a therapist listened, believed, and validated their experiences. So even if the therapist did not necessarily have, a very in-depth understanding of autism, they were willing to listen and believe and validate what that person was saying and kind of really try to come into their space, understand their world, and kind of really truly empathize with what the world is like to experience from an autistic point of view. So I think that's a real, people felt it was a really positive sign of a good therapist, and they tended to have positive experiences with therapists like that. Obviously lots of people saying that the therapist having sorry, one second. Having a good understanding of autism is really key, but in the public health service it might not always be the case. And so I suppose maybe if a therapist does have great understanding, brilliant. If not, are they actually open to listening and understanding? Then in terms of maybe some red flags, I suppose if you are hearing maybe an ableist attitude or language, that would be maybe a bad sign. Or if they're pushing a particular therapy approach and maybe not tuning into what your specific needs are, if they're questioning whether you are autistic, these are the kinds of things that people felt if they had a therapist like this, they tended not to have a very positive experience. Okay, sorry, there we go. I'm not going to go into this in any depth here because Tara's going to cover it more, but I suppose just some ideas of what you might like your therapist to know about you, maybe, before you start working with them or while you're working with them. What is your way that you like to express emotions? Because, autistic people tend to express emotions a little bit differently to neurotypical people. How would you like to express your emotions? Or, how can your therapist understand how you're feeling? Communication preferences is a big one, your sensory preferences, of course, and then I suppose how you would like them to communicate with you if there is a particular change or if there's important information that they need to share with you. I'm going to leave the rest of that to Tara in a few moments. And these are just a couple of resources, and again, I know Tara is going to cover this in a lot more detail, but a couple of I suppose things that you might like to Google, and you could, if you felt able to, share these with the professionals you're working with to give them a sense of maybe how to adapt their approach to fit you and other autistic people. Okay, over to Tara.
Thank you so much, Rachel. That's fantastic. Lots of brilliant information to consider. And as I just mentioned in the chat there, we're going to do a Q&A at the end. And it's great if you can keep your questions coming, add them into the Q&A box, and we'll try and get to them at the end. Myself and Rachel are going to have a chat between us after I give you my little presentation here about our nonprofit. And then we will, so this will be about 15 minutes. If you want to move around or anything now, do, while I'm getting ready to share screen. And then when I'm finished, Rachel will rejoin again, and the two of us will start chatting. So just give me 1 second now to get this up for you. And Rachel, can I just check? Can you see that? Yeah, great. Okay. So just to introduce you, I suppose, into what I'm going to talk about in my part here, I'm going to be talking about Thriving Autistic and the Neurodivergent Practitioner Directory. So the contents of this part are who we are and what we do, the areas that we work in, our directory, and our therapy adaptations guide, and our therapy passport that you can give to your therapist. So about Thriving Autistic, we are a non-profit organization. We're run by all autistic and otherwise neurodivergent mental health professionals. We provide an online global platform that connects autistic adults with neurodivergent therapists or coaches. And we also offer support groups and monthly peer meetups that are accessible all online. This keeps happening to me. Okay. Yeah. So our services, all of our people, all of our practitioners, our psychologists, our therapists, our occupational therapists, our coaches, they're all self-employed. And we have around 100 or so now at this point, and they're working across the globe. So you might find somebody who's not based in Ireland, who you can work with, who can work with clients who are based in Ireland. But some of them won't be able to work with you if they're based outside of Ireland. So we'll talk about that in a little while, about how to try and get get some money back from your insurance or get some claim back on your med forms for tax relief. But at the moment, our nonprofit is not funded by the government, so we don't have funded services. Everything is either we're volunteering or it's self-employed practitioners. So what we find, we've been doing this for about 3 years now, and many of the different reasons that people come to us looking for therapy would be for parenting, for coping with being an autistic parent, maybe of otherwise neurodivergent kids who maybe have different sensory needs to the parent. And you might find that you have conflicting needs, whereas maybe one person in the family needs a lot of quiet time and another person in the family needs a lot of loud, noisy experiences. And those conflicting needs can cause a lot of difficulties in the family. So it's trying to figure out and work through, you know, how do we balance everybody's needs and give everyone what they need? And that is a big, big question. It's something that I experienced myself as an autistic parent. So we've a lot of experience in working with parenting. We have a lot of experience in working with trauma. You know, I think it's important to say, we're talking here tonight about mental health and accessing mental health. It's important to say that there's so many structural issues that can cause us to have challenges to our own mental health. Not least of which from being a minority group. It's well known that minority groups experience stress from just simply being a minority, living in a world that wasn't designed for you. And then in terms of intersectionality, if you also are a member of other minority groups, that, you know, these intersect and they cause additional burden and additional strain onto our mental health. So therapy isn't just about, you know, supporting the person to change themselves, because a lot of it is the issues that where you're living and the environment that you're in, and that's what needs to be changed. So that's where we have some fantastic occupational therapists who can help, or advocates or disability benefits consultants who can try and help to get you in a better circumstances to cope with your life. So just to mention that, you know, we're talking here about mental health, but just that we know a lot of our mental health difficulties are impacted by the environment that we're living in. However, we still have experienced, many of us have experienced trauma, post-traumatic stress. These can be supported. And we do have a lot of autistic adults coming to us for this kind of support, or support with relationships, particularly if there's different flavors of neurodivergence in the relationship, or there's a neurodivergent person and a neurotypical person in a relationship, and trying to bridge that gap and figure out how to communicate with each other. That's another area that we spend a lot of time working in, helping bridge and helping those communications between two equally valid methods of communicating, helping people understand each other. Work coaching is another one, supporting people in their workplace, figuring out what adaptations they might need, supporting and training the workplace, the team in the workplace, of how to support their and get the best out of the people working for them. Or we do a lot of work as well with helping people finding jobs, helping them work out a CV and figuring out what kind of job is going to suit their neurology best. Of course, we work with depression and anxiety, people figuring out their self-identity, and people processing a recent diagnosis. So these are all, you know, part of some of our frequently supported areas. People's sensory profile, figuring out what their sensory differences and sensory needs are, communication styles and preferences, and how communication flows best for you. Unmasking, that's another area that we spend a lot of time working with people around, how to find out who they really are if they've spent a lifetime trying to fit in with others. How to learn how to self-advocate, how to care for yourself, how to regulate your own emotions, what accommodations that you might need either at home or in the workplace or with friends, or in college, unpacking our own internalized ableism. And this is a journey. I don't think it's something that anybody ever ends up and is done in. It seems to be for all of us, it's a continual journey of unpacking all the stories we tell ourselves about how we should be better, we should be able to cope with this, that, or the other. And intersectionality, as I mentioned earlier, disclosure, how to talk to people about being autistic, particularly if you've only recently figured it out yourself. And then relationships, as I've mentioned already, and identity. So they're all some of the areas that we work in Thriving Autistic. One of the things that everybody who works with us or is listed on our directory agrees to is this commitment to neuroaffirming practice. And again, this is a journey. I don't know that any person's ever come to the end and is finished with this. It's an active, alive thing that we have to continually work on. I'm not going to just read out this whole list because we won't have time to, and I'll overload you and I'll run out of speech myself, because that's one of the things that can happen to me. So, but just briefly there, and you'll have the slides, we presume competence with everyone we work with. Whenever needed, we offer alternative and augmentative communication methods. That might look like inside a session online, that we might have a session completely using text, just using the chat text box backwards and forwards. Or we might have a British Sign Language or Irish Sign Language person present if needed. We advocate for people for self-determination, for inclusion. We facilitate self-advocacy skills, and we don't support any methodology or any kind of therapy that teaches people to comply or fit in or try and mask who they are. We do take a strengths-based approach, and we respect every person's autonomy. And we appreciate intersectionality both in ourselves and our clients, working to unpack any privilege that we have. We actively are anti-racist, and we're actively LGBTQIA plus affirmative. We actively can seek out CPD, continual trainings and learnings from each other and other neurodivergent adults. And we use identity first language, which means autistic, rather than autistic, or rather than person with autism, for instance, while we respect people's individual clients' preferences. So this is our directory. And as I said, we have, you see there under therapy, this was last week, we pulled this together, this screenshot. So under therapy, we have 168 listings. Under coaching, we have 47, and under assessments, which is neurodivergent practitioners who offer formal diagnosis services, we've 28 at present. So as I said, they're all self-employed. Our future goal is to get some of these, if not all of these services funded. And you can either click through on the Thriving Autistic website and you'll find this, or you can go direct to the neurodivergentpractitioners.org. And what you'll find in there is we've got 2 levels of membership for our practitioners, and it's free for the practitioners. It's part of our goal is to support their well-being. So we offer this service for free to support all these practitioners. But the first one is the verified practitioners. It's important for you to know this. So we ask them all to give us proof of their qualification and their insurance and their ID, and that they agree to follow those commitments I've just shown you there. And so all of the people who've done that, you'll see they have a green tick beside their name, and it'll say verified. And then we have non-verified practitioners, and most of them are in the process of getting all that information to us for our screening process. But I'm sure you can understand, as we're all neurodivergent ourselves, for some people, it just takes time to gather the documentation that we need to be able to screen and verify each person. So you'll see in the pictures there's no green tick. That means they're not verified yet. trying to get some money back, if you're in Ireland and you want to work with one of our practitioners and you are looking to get funding for this, if they're an Irish therapist and they're registered with Cora, you'll be able to possibly claim back on your private health insurance. So you'll need to check with your insurers for details on that. I know that some of the insurers in Ireland, and I can't tell you which ones off the top of my head, especially because it does change over time. I don't want the recording to give you inaccurate information. But some of the insurers do also insure occupational therapists from the UK as well. So it's worth checking with them about that. If you work with an Irish registered psychologist or psychotherapist and you pay tax, you'll be able to claim back 20% on your med tax returns. And you'll find the information on citizensinformation.ie. There's the entire link there for you. So if they're a psychologist or a psychotherapist, you will be able to claim that back. If there's something else like an occupational therapist or a coach or a speech and language therapist, if you ask your GP to write you a note saying that you want this or that you need this support, and then you can submit that to revenue and then you'll be able to claim that back too. But you need to go through that process first and get approval from revenue if they're anybody other than a psychologist or psychotherapist. So we've created a self-reflection guide to help people, to help you and any other autistic adults in accessing therapy. So the self-help guide will just help you figure out, what is it that you want from therapy, and what kind of things that your therapist might need to know to be able to make the experience more comfortable for you. So we have this self-reflection guide, and I'm going to go through some of it with you now, and then it'll be downloadable. You can grab it off our website. It's going to be freely available there on thrivingautistic.org from tomorrow. So we have this self-reflection guide that you can work through, and at the end of that, you just copy your answers into a passport that we've created for your therapist, which tells your therapist these are the legally requested accommodations that you need to be comfortable working with them. So the start of the self-reflection guide is around your goals for therapy. And I mean, I know that some people will be experiencing depression or experiencing trauma or anxiety, and so the goals might be a little fuzzy right now, or they might just be, I want to feel better, and that's absolutely fine. But if there is anything more specific, this chapter here just has a look and asks you to reflect on, the different areas in your life that you'd like to see changing. And it asks you as well around what are your strengths, what are your interests, what do you really enjoy, and what challenges do you hope that therapy could help with. And then here, this is what I really wanted to get into with you, and it's around your needs and your preferences. So with this self-reflective guide, we're asking you to consider, how do you prefer to communicate? Is it by speaking, by writing, by using visuals? This could really help inform your therapy. I think I've mentioned earlier already that we will often work with people in therapy and use writing rather than voice, if that's their preferred or where communication works best for them. So you're entitled to ask for this. Consider the pace. Do you like 1 hour sessions? Do you need something shorter? Do you need a 20-minute or a 30-minute session? What pace works best for you? How do you experience eye contact? Is it difficult for you? Do you find it easy? Or have you come up with some, hacks to manage it? Like a lot of adults tell us, they look at, in the center of someone's forehead, or they find a spot above the person's head to look at. So how do you experience it? With language, do you prefer direct, concrete language and concrete, direct questions rather than open questions such as how are you? Abstract concepts and metaphors, how do you experience those? Thinking about these things and listing it down, writing examples, that will really help tailor the therapy to suit you, to suit your style of communication. And that's going to help you get the most out of the therapy. Again, with emotions, if you know, because some of us don't know at the beginning of therapy, but how do you experience emotions and how do you express them? Do you use any tools? What emotions are hardest for you to recognize or express? If you know, name them. Do you know what tools might help you identify and share your feelings more easily? And if so, name them. And then again, with your sensory experiences, you know, if you think about if you're going into a therapy room, how the environment that you're in, making it most comfortable for you so it's not an ordeal, but you can feel more relaxed there. What would that be like? What lighting, what type of sounds or smells or textures work for you, or do you find really difficult? What activities give you energy, or what activities help you relax? When you're upset or overwhelmed, how do you typically respond? Do you prefer to be left alone? Do you prefer to sleep? Do you feel like you're shutting down and you just need to cocoon yourself away from everyone? Or do you express it outwards? Do you shout? Do you move? How does it work for you? And then the last part of our self-help guide is to consider what adaptations you need. Would it work best for you meeting outdoors or over video or having a support person with you? Do you need flexibility in your scheduling, your length, or your pace of sessions? And how could your therapist best summarize and check understanding with you at the end of each session? What we do sometimes is we will send, depending on the person's communication preference, we could send them a voice note summarizing what's happened. We could send them an email with it all typed out. Or at the end of a session, if they prefer auditory, we'll just talk it through with them. So think about what would work best for you. What else does your therapist need to know? Considering your special interests, considering your passions, considering, do you like extra time to process information? Do you prefer what's called asynchronous communication? And many of us do, where we hear the information or we receive the information and we need time to think it through and process it. And it may be a couple of days later that we're ready to respond to some questions from the therapist. So understanding that about yourself and expressing that to your therapist will really help to set you up for success in the work that you're doing with them. And also it'll give you a really clear indication of whether they're willing and able and the right person to support you. You'll know by their response to these requests for adaptations. So then I don't have time to go into what the passport itself looks like afterwards for the therapist, but you can download it from the website. But it'll all come together, all your answers there from that self-help guide will pull together into this therapy passport. And this is just the first page of it, where we're saying to the therapist who we are and that we've created this guide to support them in providing appropriate care for you. And that you have taken the time to reflect and fill out this information that's vital to your care needs. So we ask them to consult your document before starting work with you. And we also offer, we accept feedback, and we offer the opportunity for people to come for consultations or ask us questions for other practitioners to do so if they want to get in touch with us for how to best support you. So this is just the overall piece then around what we do, our mission and our vision in Thriving Autistic, and that is to advocate for the rights and the dignity of autistic and otherwise neurodivergent people, promoting this inclusivity and offering our support services and advancing the neurodiversity paradigm and the social model of disability. And we envision a world where autistic and otherwise neurodivergent people are recognized and respected for what we bring to the table for our unique perspectives, where our support needs are met without judgment, and where society embraces a neurodiversity affirming human rights framework to empower us to lead fulfilling lives on our own terms. I will stop sharing now, and hopefully that has been helpful to you. Rachel, you come back into the chat.
That was great, Tara. I really love that resource that you've created, the self-reflection tool, and I think the therapy passport, it's going to be so helpful for people.
Yes, hopefully it will. Yeah.
So I think our plan now, Tara, is to chat about a couple of questions that we feel kind of maybe come up quite a lot, and maybe we can chat them through together. And following on from, I suppose, your that tool that you've created, the self-reflection and the therapy passport. I suppose we imagine a lot of people are wondering how to request these kind of accommodations and adjustments in, maybe a setting that isn't automatically set up to support autistic people, like maybe the public health service.
Exactly. That is the big thing, isn't it? It's one thing when you're seeking a private practitioner and you can shop around to find the person that suits you. But if you've gone to your GP or you've gone to community care and you're being offered a person or a group, and you feel that, you need these adaptations, what do you do? How do you ask for them? And what do you do if you feel the person isn't a good fit and they won't provide those? Yeah,
it's so tricky. And I think there's probably no sorry, I'm trying to close the chat there, it's distracting me. There's probably no kind of clear answer on it, but I suppose I think having kind of documentation and resources like that to maybe back you up can be really helpful, because I think a big part of it for clinicians in the public health sector is that there's a lot of demands on us, and then if something outside of our usual is maybe asked of us, it can be a bit scary, and we can feel a bit unprepared and unskilled with how to support something outside of our norm. So I think I'd imagine maybe a lot of people would it would open them up to these kind of adjustments and accommodations, to have those really concrete ideas in writing. So like if someone was able to fill out that self-reflection tool, or there's, like I shared earlier, the SPACE framework, which I kind of is kind of tailored for GPs, but I think is really applicable here too. If there's a few things that people can read through and kind of see that it's not all that complicated actually to adjust your approach to suit an individual's needs who's autistic. So I think those things will be a great help. And I suppose I'm conscious that it can be, quite vulnerable maybe as an autistic person to maybe build up the courage to request these adjustments, and and if that's rejected, or if someone's needs are not met, I think that could be quite hard. So I don't know, even thinking about, if I do request this and I'm not, it's not provided to me, do I have maybe people around me who can support me if that's quite upsetting, or if that's hard to manage then. So that's a couple of thoughts I had, Tara. I don't know what
I think you're right. I think spot on. Like it can be a very vulnerable place to be, can't it, to be asking for adjustments and hoping that you're going to get them if you're in the public service, but it is much better nowadays. I do think that there are so many resources out there, to support clinicians in learning about how to work with autistic adults and otherwise neurodivergent adults. So that's good. And as you said, the SPACE framework and our guide, and we've often had we've done lots of trainings with different mental health teams, and over the last 3 years we've been training the new upcoming clinical psychologists and educational psychologists in UCD and in Trinity. So hopefully, you know, it is all kind of starting to filter through, and we have many resources available for clinicians to come to if they want to gain that information and learn about how to better support us. But I think you're spot on that it's a really good idea to have somebody, a support person with you if you're putting yourself out there in a vulnerable position and asking for that support. But I mean, what happens? What are your rights, do you know, Rachel, around, like, if you're with a mental health team and you just feel you're not resonating with wherever the assigned person is it just simply resource dependent that you can ask for somebody else, but it depends on whether there's another psychologist available or not? Is that the way it works?
Yeah, I'm not 100% sure. I'd imagine it is resource dependent though, and even just team dependent. And because I as far as I know, that, you know, there aren't maybe clear guidelines on it. So I suppose then it comes down to, you know, the person that you're working with, or, you know, maybe if you are going to the team lead, if there is one, and requesting a change in therapists, you know, they might take that well, they might understand where you're coming from, or they might you know, not take that so well. It's really hard to know. But I suppose,
well, I think it's good though for people to know that there's no guideline down there yet for it. It's good to know that, because sometimes we can think, okay, well, this is our right, this is our human right, which is true, it is, to be treated with respect and dignity. But if you're feeling like you're not being treated with respect and dignity that you deserve, what do you do? And to know that it's, I mean, I guess as HSE your say that you can send messages to. There's also AsIAm, I know, to offer advocacy and support, and we do too. Thriving Autistic, we often will write letters on behalf of people to services to point out, you know, that these are legitimate needs that this person has, and we'd really be grateful, you know, and appreciate them following through on them. So that has had quite a bit of success as well.
That's brilliant to know. Yeah, because just having, you know, someone there by your side like that, maybe write a letter or even talk through with you, you know, how will I approach this with the team? It's really helpful.
And I think, as you said, like, it's a really good point that, like, it can be scary for clinicians if they're being asked to do things outside. We all know how stretched our services are, and to be asked to do things that are outside what we're used to doing, it's scary at the beginning. But as you said, there can be just very simple adaptations made, like turning down the lights or making sure there's no, you know, made very strong smells in the room, or air out the room before your client person comes in, and different things like that, or give some information written or recorded afterwards.
Definitely. And I think, you know, it doesn't come from a bad place, I think, most of the time, when you know, a professional doesn't kind of automatically adjust to someone's needs. It comes from that place of maybe fear or feeling unskilled, or so, you know, I think, I don't know, maybe I'm too optimistic about it, but I think most people actually, once they get the information, it's nearly kind of exciting in a way. They're like, okay, like, look at these things I can try now, and look how, you know, much this is helping this person, and it can kind of, you know, stir them on then to try that with other people. And, you know, I think people are open to it, you know, and look, ideally,
there's definitely a groundswell, isn't there? There are more and more people being open to it and wanting to do it, and it's more empowering position to work from anyway, when you're empowering others and meeting their needs.
And I think I just want to acknowledge as well that, you know, it's not ideal that the client or the person attending the service has to educate the people working in the service about, you know, that's a really there, and it actually shouldn't be that way. So I want to acknowledge that as well. And I suppose I guess we're speaking from a practical point of view, Tara, aren't we? That, you know, in the world that we're currently living in, these are things that might help, even though the burden should not be on people accessing the service to
100%. I mean, ourselves at Thriving Autistic and AsIAm and Middletown are working together to create CPD training for all Irish counsellors and psychotherapists at the moment. So that's going to be released shortly, and hopefully that will be, you know, really useful for people to know. So it really is not up to the client to have to, the person to have to educate their but as you said, this is the reality sometimes in the world we're in right now. Although if you can access our neurodivergent practitioner directory, you get to work with people who understand it from the inside out because they're autistic too, or neurodivergent themselves, and they've, you know, done extensive training as well. I'm working with other neurodivergent people. It doesn't always mean just, you know, people are not always going to resonate. It doesn't mean just because you're both autistic, you're going to get on. We're all, the world isn't that simple. But you certainly have a good shot if you're working with a verified professional with us, that you know that they are qualified, they're insured, they've signed up to agree to this whole framework of neuroaffirming practice. They understand that. And then if you can bring that guide with you, if you can do that and work through the guide and bring your passport with you so that they understand what your needs are before you begin, that's, you know, going to bring you a lot of the way into having a good experience.
Definitely. Yeah.
Do we have any? I know we're coming up towards, is there questions there we haven't?
We do have some questions coming in.
Right.
Yeah. Are you happy for me to just kind of read them? Yeah, perfect. Yeah. I see Sarah there answering the therapy passport one. Is that going to be available from tomorrow, was it?
Yeah, it's launching
tomorrow.
Yeah.
Brilliant.
Well, launching tonight in this conversation.
Tonight, yeah. This is our massive launch. But yeah, no, brilliant. Yeah, just for anyone else who was probably sitting there wondering that as well. So it'll be available from tonight, tomorrow.
Yeah.
Fabulous. There's a question about the CPD that you referenced, Tara, just asking, is it going to be specifically related to autism or other neurodivergencies too?
So initially this is specifically related to autism, and it's and then hopefully we will move on to other neurodivergencies too. There is a need for a broader, some of it will be relevant, of course, but there is definitely a need for a broader training for neurodivergency generally. But this CPD, and we have been working on this for nearly a year, there's a huge amount in it. So it's very specific to autism.
There's one about, I think it came in, Rachel, when you were giving your presentation. So it says, Rachel, thank you. Great presentation. Can you explain, please, why it's a red flag if therapists suggest social skills training? And then she says in bracket, this person says, for someone suffering anxiety in social settings.
Yeah, I suppose there's lots of reasons for it. I think, you know, first and foremost, we don't have any evidence that social skills training works. I think that's an important thing to note. But I think maybe more importantly, what we do know from the research is that if an autistic person is, you know, what we call masking, so trying to maybe conform to a neurotypical style of interacting and communicating, that puts a huge amount of stress on the person and can actually result in more significant mental health difficulties. So I suppose that would be, you know, in the context of mental health, why we'd really advise against it, because it can actually have the opposite effect and make someone's life more stressful, and kind of cause their mental health to deteriorate. So I suppose we'd maybe more so you'd more so hope that, or look for a professional who would be supporting you to identify your style of communication, and maybe how to, you know, maybe seek out people who also have that kind of a style, or maybe how to advocate or explain to your partner or friends or loved ones, this is the way that suits me best to communicate. Could we meet in the middle, or could you meet me somewhere? I don't know if you've anything to add to that, Tara. That would be
no, that's great. That's great. Can I jump in with I see there's another question here.
Of course, yeah. Like if you see any of them, just go ahead. Yeah, fireside.
So someone asks if you don't, do we offer where am I? Do we offer reduced fees for support for people who can't access otherwise? So, as I said, that our practitioners are self-employed. We don't pay them; they get paid from our clients, and many of them do offer reduced fees. Many of them do, so it's worth checking. You can just send them a message, but generally they'll say it on their listing anyway. Also, our monthly meetups. So this is not mental health support. This is peer support, but facilitated by professionals. So those monthly meetings are donation based, and we usually have about 100 people come together. And so they're free, or you can give a donation if you have any money. We also do a 6-week program that runs 4 times throughout the year. And again, that's donation based. So you can access that either way. But for the one-to-one work, that's with the practitioners who are self-employed, and they need to get paid to eat and live. So they do. I know many of them do offer reduced fees. And then just the final, I wanted to jump in with the other question the person asked, which is a great question. Why don't we use therapists who are knowledgeable about autistic people, but they're not autistic themselves? And I think that's a great question. We love allies. We absolutely love allies. It's just that we thought it would be really great to create a space where we have neurodivergent practitioners ourselves in a room, because we do a lot of support, peer support for each other and peer supervision. And so it's just really unusual and really nice to be in a place, because we have our own challenges being neurodivergent. So we can talk it through ourselves. And yeah, so that's it. We have nothing against people who are not autistic or neurodivergent. We absolutely love our allies, but this is just, we thought we'd have a space for just us.
Yeah, and there's another one here. I don't know if you guys know the answer, but it just asks what kind of time frame can one expect from referral to being seen in the community adult support mental service? So I think they mean, like, the public. I don't know if you'd have any insight on that, Rachel, through your research, or
unfortunately the answer is that it varies
yeah.
hugely between services, and also between people, depending exactly what's going on for you. Some teams might have a prioritization system, so it's impossible to say. What I would suggest to that person is, if they're able to give the service a ring where they've been referred to, and usually the administrators on these kinds of teams are able to give some information. They might not be able to tell you this is when you'll be seen, but they might be able to tell you, such and such has looked at your information and it's going to be discussed, or they might give you a sense of where your referral is at. So because it just varies so widely, I'd say if you are in a position to be able to give them a ring, do. You could even ask, if you have a partner or a friend or someone who could give a ring for you, or you could ask your GP if they made the referral for you to follow up on it, either if you don't feel able to ring that service yourself.
Yeah.
Thank you, Rachel. That's all the questions I see in the question box. If anyone else has any more questions, you can just pop them in the Q&A box. Yeah.
I'll just say about the community mental health as well. That's our experience too, that if you can contact or have someone contact on your behalf, if you feel that you can't do it yourself, it does seem to help somewhat. So you get a bit more concrete, even an idea, as you're saying, of how long the wait is going to be.
We have a question just about the slides. When can we expect the slides from today's presentation? I'd like to write out some notes on the information.
So I can upload mine right now if you want.
Okay.
How are you doing that, Tara? Do you just upload? Are you uploading them into?
Just pop it in the chat. Usually that works.
It's a good loophole.
Very good. I might.
Oh, it may not, because it's a webinar. Hang on, let's see. It depends on whether it's been allowed.
If not, you guys can send them on to AsIAM, and we can we can circulate them. Just anyone who signed up, we can send them out just a follow-up email just with the slides as well.
Perfect. Oh, that'd be great, Nicola. Thanks.
Yeah, no worries. Stop you guys stressing.
Yeah, it's not jumping in.
Yeah, it's not working. We have another question here. Just any advice on severe anxiety apart from medication?
I suppose that's really, really hard to answer.
Yeah.
No, but I'd want maybe if you could work with someone to figure out maybe if there are particular contributing factors to the severe anxiety, just to get a better understanding of it initially. I suppose there's especially with anxiety that's very severe, as this person has said, it's hard to give a tip per se, but I'd say working with someone to help understand what's causing your anxiety might be a place to start.
Yeah.
Clara?
Yeah, I would think so. Exactly. It's we're so individual, each of us, and we wouldn't be doing you a service to just give a glib tip right now. It's exactly as Rachel's saying, you need support to figure out, for someone to help you figure out where is this coming from, and then to co-decide together what the best way to tackle it is.
Yeah. We have one more here. It says, great presentation, thank you. I'm just curious about your thoughts on psychologists and other therapists, possibly trained years ago, who may have internalized ableist views and may therefore be defended against the possibility that they may be autistic and unconsciously masking. Sorry, that was a mouthful.
It's such a great question.
Yeah.
Anecdotally,
Maybe,
anecdotally, we do see that. All right. Yeah. But obviously, I mean, it's not appropriate for anyone to, to armchair diagnose anybody else.
Yeah.
It has to come from within them.
Yeah.
There's always the possibility. We're everywhere.
Yeah. So true. That's all the questions. There's a lovely comment there saying brilliant presentation with very helpful information. So thank you all. Have a nice evening, which is a lovely note to finish on. It was really, really helpful and full of information. I was just like taking notes myself as well. So, and I'm really excited as well for the therapy passport. I think be very helpful for a lot of people out there. So thanks a million. And I I was just blabbing on a bit there, just see if any more questions came in, but I don't think they have. But yeah, we might leave it there then, guys. Just to mention that I'm more than happy to send out the slides as well as a copy of the recording. That just reminds me to stop recording there.